Good morning, ladies and gentlemen. It is a pleasure to welcome you all to the 5th Annual Scientific Conference of the Sri Lanka Sports Medicine Association. Today is a gathering of not only minds, but of momentum, whether we speak in the language of physiology, movement science, orthopedics, rehabilitation, or coaching. What unites us is the belief that the human body, when nurtured and empowered, is capable of extraordinary things. May the insights shared here ripple into better practices, healthier athletes, and a stronger sporting future for all. So without further ado, let's begin today's program. As we set the stage for our first scientific deep dive, we begin with a theme that touches the very foundation of medicine in motion: health empowerment through exercise. In this symposium, we journey into the heart of therapeutic exercise, from its physiological grounding to its clinical applications. We explore the science of optimal loading, the art of designing targeted exercise protocols for weight management, and the vital role of movement in managing chronic disease. To guide us through this essential session, we are honored to welcome two esteemed co-chairs. Dr. Rangana Hettige is a consultant sports and exercise medicine physician at Teaching Hospital Peradeniya and is the secretary of the Sri Lanka Sports Medicine Association. Dr. Tushanta Vijay is a senior medical officer in sports medicine at the Colombo South Teaching Hospital and is a committee member of the Sri Lanka Sports Medicine Association. With the two esteemed chairs at the helm, we open the floor for the first session. We kindly invite all participants to engage with the panel through the Q&A session at the end of the symposium.
He is a member of Board of Studies, Faculty of Physical Education and Sports Science, Rajiv Gandhi University of Arunachal Pradesh. He is a founding president and current general secretary of Indian Society of Sports and Exercise Medicine. He is also holding position of faculty and examiner of sports medicine and physiology, National Sports University in Physiology, Institute of Medical Science, Varanasi, India. Dr. Barun, please come to the stage for your valuable opinion.
So thank you very much for inviting into this prestigious conference, and I am truly honored. I am Dr. Hanjabam Barun Sharma, sports and exercise medicine specialist, clinical and interventional physiologist. So I will be talking a little bit about different aspects of the sports medicine and the basis in exercise, the physiology, clinical physiology. And it will be, since the time constraint is there, so I will be a little bit rushing around the slide. So first of all, we have to understand what is the interventional physiology, because everything comes down to the interventional physiology, where the use of the physical activity and exercise and other interventional physiological techniques like nutrition for performance enhancement, not only for the performance enhancement, but also for the athletic performance. That's why clinical and interventional physiology comes. And under this clinical and interventional physiology, there are so many sub-branches. Like, for example, functional medicine is coming up, lifestyle medicine is coming up. And apart from the lifestyle medicine, we have the sports and exercise medicine, where the optimum human health performance, with minimization of the doping and the injury and illness, that's the ultimate goal. Having these two concepts of sports medicine and exercise medicine, where in sports medicine, we basically deal with the dope-free performance optimization. And in case of the exercise medicine, we use a therapeutic exercise as well as for the maintenance of the fitness and health. And this is the definition which we have given in sports and exercise medicine. This was given by our society, because a widespread acceptance, the definition of sports and exercise medicine is not present. So this is the definition we try to give, and you can see that everything has been covered. Not only injury, not only illness, but also for the fitness and health optimization. And why movement is important? Because we as a human being evolved in the Africa, in the savannah, as a persistent hunter. That's why our brain has been involved. And if we focus too much on sedentary activity, then we are going against the evolution. That's the problem. So many lifestyle diseases are happening because of that. And we already know that exercise is medicine. I will not go into the detail. Lots of paper publication has been done. Lots of publication has been done, the use of exercise as a medicine. The point is we have to know how to use it, how to use properly. That's the main focus. And again, there is also the concept of the optimum zone of the exercise, because if you go to a little bit higher zone, that's, health risks may be present. And that's why the extreme exercise hypothesis is there. We have to be very careful. If you give suboptimal loading, then what will happen? Subtraining or undertraining will happen. If you give more, then overtraining and illness and injury will happen. That's why we have to focus more on the physiology rather than the pathology. So balance has to be maintained, and this balance is very important. So monitoring of the different health and physiological and biochemical parameters is extremely important, and is an important part of the sports and exercise medicine. And if you see the concept of the external loading, your body has to have that capacity so that the loading can be done, so that we can prevent the injury. And in order to have that capacity, you should be focusing on different fitness parameter. It may be health related or it may be skill related. And these are the different fitness parameter. And as a sports and exercise medicine physician or a or a scientist, you have to love your sports and you have to know how different things are playing. That's important. So let's focus on one of the parameters, like for example, cardiovascular endurance. This is the testing we regularly do in the lab. And you can see that it is not only important for the player, but also important for the common people. Like for example, type 2 diabetes. Type 2 diabetes, VO2 max or cardiorespiratory fitness is one of the most predicting factor for a type 2 diabetes. And because in type 2 diabetes, obesity is also there. So if you want to see what is the effect of the obesity and what is the independent effect of the cardiorespiratory fitness, you can see that when you control statistically, when you control the effect of the obesity, still you get the significant reduction in the VO2 max. That's why fitness is more important over and above the obesity also. If you are obese is also, if you focus more on fitness, then that thing is there. And this is we have published different papers. And in this graph, you can see that in the y-axis, that is the HbA1c, that is control of the blood sugar. And the control of blood sugar is inversely proportional to the aerobic fitness. That's why, in management of the different conditions, fitness is very important. And also for the players, aerobic fitness is important for the prevention of the various diseases, the injuries. That's why we have published lots of papers, so I will not go into the detail. And HRV also, we will be having the session. And apart from the HRV, we can record the, phonocardiography also, and we can record PPG, that is photoplethysmograph. These are very simple instruments. This is just recording in our lab. And why this is important is if you record the PCG along with ECG, and in the second heart sound, you can find out this duration, that is the QT by QS2. Why this is important? It denotes the sympathetic tone of that heart. Why this is important? Because if you go into the neurophysiology, electrophysiology, when there is a parasympathetic dominance is there, which happens usually in case of the athlete, endurance athlete, but superimposed on that, if you have the sympathetic activity, then atrial fibrillation is there. And also the ventricular fibrillation is the most of the common cause of the sudden cardiac death. So that's why the recording of the simple recording of the death thing, we can predict all these things. And if you understand the basis of the electrophysiology, you can see that when vagal tone is high, then you will have the less the action potential duration, and that is the cause of the early EAD, and that may be the reason of the atrial fibrillation. And atrial fibrillation is the most common cardiac arrhythmia in case of the athlete. This is one has to understand. And apart from that, we also measure what is known as pulse wave velocity, which tells about the endothelium function. Endothelium function is very important. These are the simple technique which we use in our lab. And why this is important? Because if you see the VO2 max with the RMSSD, that is the heart rate variability, that is the directly relationship is there. So involving fitness also modulate your autonomic function, which has direct control on different the part of the tree. And this is the basically yoga intervention which we have done in a few students. And you can see that everything which denote the sympathetic parasympathetic tone increases. So I'm not going to the detail because we will be having the HRV session. The next thing. And also if you see the QT by QS2, that's very important. This is not regularly used in case of the sporting field, but it's a very old concept. And you can see that there is a negative relationship is there with the VO2 max. This is the data from our lab, and you can see that after doing a training, exercise training, and you can see that there is the improvement happens. That means sympathetic regulation to the heart is improvement, and the incidence of the arrhythmia can be decreased. Same thing, pulse wave velocity. There is a negative relationship. That means with aerobic fitness, with more focusing on fitness, you enhance your endothelium function, vascular function. In the same thing, these are the different graphs, and you can see that this is the recently. Oh, sorry. This is the recently which we done in case of the hypothyroid female pregnant women also, and we find that they have a deranged pulse wave velocity, and if you keep a small type of exercise for a few weeks, then improvement happens. So exercise is indeed a medicine, and you can see that 5 to 25% of the sudden cardiac death happens because of the viral myocarditis may be there, and our society has taken a lead during the COVID time. Also, we have published lots of these things, what to do in case of the myocarditis and what not to do. And this was published as a chapter. I have written a book chapter in the sports science in India. It was published in collaboration with the UK one university. And again, if you go into the detail of the endocardium, certain athlete heart is there, and if you see, different type of the parameter here, the echocardiography, and apart from the echocardiography, there is always a doubt when, say, the septal, thickness is around, say, 12 to 15 millimeter. How are you going to differentiate it? Because we said that if you stop the training for a few months, then there will always be reduction in that thickness. Why? Because that's kind of the detraining. But again, this is a paper which we have published using the the echocardiography. And if you normalize the echocardiography finding with the lean body mass, because if you do training, then your lean body mass will also increase. But if you normalize that, everything becomes non-statistical significant. That means the change happening is because of the physiology. So this is one of the easiest way where we can find out, these things. Again, anaerobic fitness and medical muscular fitness also we focus because, muscle strength is very much important for the prevention of the different the injury. I will not go into the detail of the papers. This is the different papers we have published from our lab. And one of the most important problem which we are facing in Southeast Asia is a sarcopenia and a dynapenia, where the reduction of the muscle mass with the age is there. And our lab have started, the concept of the muscle-centric approach, MICMA. We focus on resistance training, we focus on optimum protein, intake, and different other things. Because ultimately, for longevity, muscle is very important because muscle is the organ for good health, and fat is the organ for inflammation. So you want to minimize your fat, you want to improve your skeletal muscle. And this is the sarcopenia guideline we followed in our lab, where we focus on not only on the muscle strength, but also on the performance. Like, for example, say 6 meter walk, or say appendicular skeletal muscle mass. And that's how we diagnose. And this is the picture from our lab. You can see that by using a resistant training, MICMA approach, you can increase the simple hand grip strength. Or you can increase the speed of the 6 meter walk test, or the 5-time chair stand test, or say appendicular muscular mass. So exercise, you can prevent the damage in sarcopenia, and this is the Indian guideline. I was one of the author of this guideline, where we direct the different clinicians. This is another paper where we focus on different management of sarcopenia. Apart from the sarcopenia, muscle imbalances, as a clinician, we focus on various muscle imbalance. Like, for example, this is the classic case of the Janda. We don't find it, proper, may not find in a clinical practice. But still, it is always better to use, handheld dynamometer to measure different agonist and antagonist, muscular strength. And this is the value from our lab. If you are having, an athlete who is having a non-specific back pain, then there, this ratio of the flexion divided by extension ratio, it can derange. That is extension strength, endurance strength reduces. So by using a specialized core stability exercise training, you can target this part, which is having the problem. Similarly, if you see the adduction and abduction strength also, the ratio should be around 1. but here 0.6 was there in case of the adductor strain, the athlete. And if you give a certain exercise, like for example Copenhagen exercise, then it can be improved. So in this way we can do different things. Similarly, this is our lab setting, where we can find out the different agonists and antagonists, and that one is the different machine. And especially for ACL tear also, everybody knows that the hamstring is so much important for ACL, because for the prevention of the ACL, a simple ratio of the, it must be, if you compare the hamstring and the quadricep ratio, it must be around say 0.8 or so, but the reduction is there. You can see that in one of the athlete we find to be 0.47. So after doing a hamstring exercise, like for example Nordic hamstring curl is very important eccentric exercise, you can improve the the ratio, and you can prevent the fissure happening of the second ACL tear also. And similarly for a balance exercise is all very important in case of any ligament tear. Even if you have having an ankle injury, simple ankle injury also, proprioceptive exercise training is very important if you want to reduce the fissure, the injury. This is the balance board exercise we are having in our lab. And based on the physiological principle also, you can use your hand in order for the treatment also, like in case of the manual therapy. We use different kind of the manual therapy where we focus on the autogenic inhibition and the reciprocal the inhibition. Like for example, this is what I am doing for the PNF stretching, where we tend to increase the flexibility, we tend to reduce the muscle spasm. Similarly, muscle energy technique we use on different case, like for example quadricep, for example in hamstring, hip abduction, piriformis syndrome is one of the case where we use the piriformis stretching is done. So I will not go into the detail. These are a different technique of the muscle energy technique, manual therapy technique. Similarly, I am doing the muscle therapy technique for say hip, the abductor, for the piriformis. And similarly, when you have dry needling also, simple dry needling, you can do it. Like for example, here I am doing the dry needling here, and by stimulating the dry needling also, you can reduce the things. And simple, the other measures are also there. We generally use it. And also regarding the eccentric training, eccentric training, you must remember that eccentric contraction is the one of the contraction which has a more force. It has a more, potential for muscle strain, injury. So eccentric training is very important, as by simple using a jump test, like drop jump and everything, you can train the athlete. Like for example, this is the isometric mid-thigh pull we are having. So if you compare isometric mid-thigh with the vertical jump or drop jump, you can see whether your eccentric training is required or not in case of the athlete. So that's so that's important, and these are the some of the graphical the presentation. So similarly, we publish a book on the eccentric training also, and these are the different exercises which we prescribe for the so different these things. So I will be rushing, and finally we give the PRP also, because PRP also be considered to be a physiology. You are just extracting your blood and you're concentrating and applying. So that is the point. And these are the different PRP techniques which we use in our lab, so I will not go into the detail. And blood flow restriction training is also there. So these are the different this thing. And this is the Dr. Sankal. We are in the neurophysiology of the operation theater, and we are having the sleep, the chrono medicine is also sleep. This thing is also there, because if you see, the athlete who sleeps less than 8 hours, they have a 1.7 times increased risk of injuries there. So these are the different things which we do in our lab. And I must thank the organizer for giving me this opportunity. And if you have any questions, then please ask me. Thank you very much.
Thank you very much, Dr. Barun. And this is time for the question and answer session. And I call upon our speakers to come onto the stage for seated for this session. Thank you very much. And I'm giving this opportunity to the audience for asking any question from our esteemed speakers. Yeah.
Good morning, sir. I have a question for Dr. Manage. Sir, you said if you are doing concurrent training, you recommend it's better if you do the strength training first, followed by the endurance training. I don't know if it's a myth or not, sir. I've heard that if you are doing both, let's say at a very high level, if you do the strength training first and followed by the endurance, the testosterone or growth hormone release might be obturated, and that they recommend endurance training first, then the strength training. Is it a myth or is there something behind that?
Yes, actually, it is depend on the individual goals. So first thing is, usually we recommend strength training first and endurance later because of you should have some energy to do the endurance. So I don't think that I haven't seen any evidence for your I haven't seen that, but for endurance athletes, if you are training athletes, so for them endurance better to go for endurance first and then strength training thereafter. So that's the evidence in the recent researches.
And Dr. Barun, do you have any idea on this one?
Thank you very much. So if you go into we'll speak a little bit from the physiological point of view. So resistance training, the messenger RNA, the secondary messenger is the mTOR pathway, if you understand the mTOR pathway. And for aerobic training, it's always AMPK kinase. So there is some interference effect is seen where the AMPK kinase may inhibit, some of the mTOR pathway. That's why we say that when you do concurrent training where aerobic training and the resistance training is combined, maybe, muscular adaptation in case of the hypertrophy may be affected. So, but in case of the concurrent training, why the sir has said that it's always better to focus on because resistant training has a minimum effect on the AMPK kinase pathway. So that's why aerobic, your VO2 max and aerobic training may not be affected as much, if you focus a little bit on the strength training. That's why. But always you have to focus on the law of the specificity of the exercise training. So if your athlete is in endurance training, you have to focus on endurance training. And if your athlete is focusing more on the strength part, then you have so exercise rules are also there. You have to focus there. Thank you.
Thank you very much. Any other questions?
Thank you so much. So my area is nutrition, and I'm also a health fitness coach, and I've coached over 1,000 individuals. My question is, where do we draw the line between training and overtraining from the physiological perspective? Because in the beginning, patients and clients don't have the motivation, as all the speakers said, but once they get the motivation, they're over-motivated to overtrain. So how do we draw that line? Thank you.
I think that question is for you, Mr. Barun.
Thank you very much. So overtraining, there is no, except that the biomarker is a combination of the biomarker and the physiological and clinical parameter which we take into consideration in order to diagnose overtraining. One of the most important case of the overtraining is if you persistent, if you increase the training, the performance will be decreased. The performance is the most important point. And there are also mood swings and sleep, the deprivation is also there. And if you measure a simple, the physiological parameter like suppose HRV, heart rate variability. So if you measure the heart rate variability also, you can see that, it's going into more into the sympathetic tone where the high frequency are reduced, low frequency, high frequency ratio is affected, RMSSD is little bit reduced. And if you see the morning heart rate also, it will be a little bit on the higher side. And if you see in the, for example, say the endocrinology part where testosterone and cortisol ratio, if you take it for a very long time also, so it may be little bit affected also. So subjective outcome measure is very important, although it is subjective, but the athlete will tell you the sleep deprivation, everything, and based on that, your clinical reasoning and all the biochemical and the physiological parameter you combine together, and then you have to draw that particular line for the treatment.
And due to the time constraints, we'll stop the Q&A sessions. And if you want to take any answers or any questions from him, please meet them at the tea break or the lunchtime.
The session has truly sparked new perspectives and illuminated key pathways forward. Time to honor our speakers and chairs. We kindly invite our chairpersons for the session to present the tokens of appreciation to our speakers. We now warmly invite Dr. Hanjabam Barun Sharma, Dr. Dimu. We now invite Dr. Asela Ratnayaka, consultant in sports and exercise medicine at Teaching Hospital Kandy, to present the tokens of appreciation to the chairs of this session. We now invite Dr. Rangana Hettige and Dr. Tushanta Vijay Singham.